Hey everyone, thank you so much for joining me. So today we are going to go through my Spinal Hygiene stretching program. Now, if you are a patient of the clinic, chances are I have given you this handout. It's front to back. It takes about maybe 10 minutes to go through the whole thing, but this is my go-to for pretty much everybody that wants to work on their posture, work on their alignment. Anyone that has a lot of subluxations or tension or any aches and pains in their spine, this is something when I go into workplaces, I do this with, when I do corporate talks, I do this with the employees. Anybody that sits at a desk, oh my gosh, this is so good for you. So that's what we're going to do today. I'm going to go through it. I know a lot of you right now are working from home, and you know, this is something you could do periodically throughout your day to just really reduce that tension and reset your posture. It can help you get through the day without feeling so sore, right? This is something some people like to do this first thing in the morning just to loosen up their body if they're stiff. Some people like to do this whole thing at nighttime before bed just to help them calm down and relax, get off of social media and just focus on themselves to get ready for bed. There's lots of different ways that you can do this program. But the biggest thing is to do it and be consistent with it. If you're consistently stretching, consistently doing things like getting adjusted and getting massages and you know, taking care of your posture, then it's going to be healthier for you. So we're going to do this program together, and I'm going to give you my best advice on how to do all of this. Now, a couple ground rules. First of all, if anything hurts, you stop. So generally with stretching, it should be a little bit uncomfortable, but it shouldn't be painful. You've crossed a line if it's painful and you need to ease off. And if anything really bothers you, feel free to reach out to me and I can help give you some advice on it. But that's number one, okay? Don't do anything that hurts. Number two, with any of these exercises, if you're feeling dizzy or anything, please sit down. A lot of these things you can actually do from the ground. We're gonna do them all together standing because I think it's important, especially if you've been sitting for the whole morning working. Now you wanna stand up and just, you know, get yourself up. But if you need to sit, you can do that. The other thing is no bouncing. So back in the 80s, we used to think bouncing with stretching was the right way to do it. We now know it's not. So you're just holding the static stretch. And the last thing, what was the last thing I wanted to tell you? Yes, timing. So we want to hold our stretches anywhere from 15 to 20 seconds. That's the dream duration of the stretch, okay? So I'm going to go through these. There are two at the end that, I know I said we're going to do them all standing. There's two at the end that you can do on the ground, but we're going to go through the program standing. So I hope you'll join me and do it with me, and let's do it. So the first one, we're going to start with our neck stretches. So the first one, you're just going to kind of stand nice and relaxed, and you're going to drop your head down. So your chin is going to touch your chest or as close as you can get it. Now, once you're here, you can close your eyes if you want to. I encourage you to take a deep breath in. And when you exhale, just when you exhale, drop your shoulders so you get a little bit deeper of a stretch and you're relaxing. If you want, you can take your hands and place them behind your neck and do a little bit of a pull. But let's just hold this stretch here for a few more seconds. If you're pulling, make sure you bring your elbows in. You don't want them winged out like this. Bring them in. And just hold that. All right, now come back up. Now we're going to do the opposite. We're going to look up to the ceiling. So you're going to stretch out. You should feel a little bit of a stretch in the front. Close your eyes, relax your shoulders, deep breath in. Hold it, and exhale. See how my shoulders totally drop when I exhale? Let's hold this stretch for a little bit longer. All right, and now come to center. Now we're going to do a rotation. So you're going to turn towards the right. So you're keeping your shoulders. A mistake I see people make with this is they turn their body. So you don't want to do that. Keep everything neutral. You're just turning your neck. You should feel a stretch here on the side. Now relax your shoulders. Close your eyes if you wish. Deep breath in. Hold it there. And exhale. Just relax those shoulders. Let's hold it for a couple more seconds to get a really good stretch. And now we're going to slowly rotate to the other side. So again, keep your body neutral. Turn to the other side. Relax. Feel that stretch here. Deep breath in. and exhale. So make sure you're standing nice and neutral. Your body's, remember I said don't turn your body, just turn your neck. And let's hold this stretch for a couple more seconds. All right, and now let's look in the middle. The next one we're going to do is we're going to bring our ear to our shoulder. So just like with rotation, you keep your body nice and neutral. Don't move your body like this. This has got to stay. You're just tilting your neck. Try and bring your ear to your shoulder. Keep this shoulder down. And you should feel this in the side of your neck. Another thing, you don't want to be rotating your head at all. Okay, so it's just literally a tilt. Nose is pointed forward. Now, if you want a little bit more out of this stretch, you can take your hand that's on the same side that you're tilted to and do a light pull. But close your eyes if you feel comfortable. And now let's take a deep breath in. Breathe in. Hold it. And exhale through your mouth. Big exhale. And just relax those shoulders. Let's hold it for a second. Now, slowly come out of it, and let's slowly go to the other side. So same thing, keep your body neutral. Give it a little pull if you want. It's your choice. Close your eyes if you want. Again, that's a choice. Of course, if you're dizzy, leave your eyes open. But take a deep breath in. Hold it, and exhale. And let's just hold that together. So you should be starting to feel a little bit more relaxed. Part of this is not only to, and just come out of the stretch, but part of this is not only to loosen up muscles, but literally it's an emotional break, and you should feel relaxed, especially if you're doing the breathing with it. Now the next one's, I'm going to have to demo it a little bit and explain it, because sometimes people can get confused on what we're going to do. It is a neck stretch, but you're trying to look or point your nose towards your armpit or towards like your pinky toe. Pinky toe, baby toe, okay? So what you're going to do is you're going to do it in two parts. The first, you're going to go down as far as you can, straight down. Then what I want you to do is rotate towards your armpit. So already right now, I can feel this. If you don't feel anything, it's either because you haven't gone all the way down or you haven't fully rotated. You need to kind of get to end range with this, okay? So come all the way down, rotate, look towards your baby toe. Now take your hand of the side you're looking towards, put it on the top of the head. Okay, not the side of the head. It's got to be right at the top, and then give it a little pull if you want. So again, you should feel this on the back on that side. So let's take a deep breath in and exhale. Let's just hold this stretch. This is actually one of my favorite stretches for people when I work on people's spines. This is an area that is always so tight, this upper back area, kind of the base of the neck. So this is a really, really good one to do regularly. So let's just hold it for a couple more seconds. And let's slowly come out of it. Now we're going to do the same thing on the other side, okay? So just reset your posture, drop your chin to your chest, and rotate so you're looking towards your baby toe, or your nose is towards your armpit. Take that hand, top of the head, give it a little bit of a pull, and you should feel it here on the side of your neck. So let's all take a deep breath in and exhale. And just let that relax. So with these stretches, like I said, you can do them all in one go, but don't be afraid to break it up sometimes. If you're feeling tight in a certain area, you can just throw a stretch in. Some people like to, every hour they get up from their desk and do a couple of these, so break it up throughout the day. Whatever you need, there's lots of ways to do it, okay? So next on the list we're going to do is called a spinal twist. So this one's really good. This actually is more of a dynamic stretch. We're going to be moving as opposed to just holding it. But think of this one, you may have heard me talk about flushing out your spine, or like you brush your teeth, you brush your spine. So this is kind of flushing out fluids that sometimes build up in our spine when we're really stagnant and not moving. And it's like brushing your spine. So it's the same thing. So we need to have, this is why I've called this whole thing spinal hygiene. So it's like dental hygiene. So hopefully you can relate to that. But what you're going to do is you're going to hold your hands in front of you and you're going to rotate. So you're going to rotate one way and then you're going to rotate the other way. So we're going to turn like this, and then you're going to go back and forth. Now, before you join me, just a couple things. Make sure, Allison just left me a message. Thank you for doing this, Dr. Doni. You got it. Thanks so much for watching. If you have any questions, please be sure to type them in the comments, and I'll be able to answer your questions, okay? So we're going to rotate one way, but I want you to make sure you're turning your head. This exercise gives full rotation from the the segments at the top of your neck to the base of your spine. So let's go one way and the other way. And you just keep rotating back and forth, full range of motion. Now, if you feel any popping or anything, there's two reasons for that. Could be that you need an adjustment, so you might need to see a chiropractor. But a lot of times that can happen as well when we've been sitting for a long time and not moving. Okay, so come on up. So again, I've mentioned this already, but if you have any dizziness issues, don't do that. But just about 20 seconds, if that 10 seconds of going back and forth can really get your spine moving better. Now I'm just going to flip my page because we're going to go to the second half of it. So we're about halfway done. So the next one is chest opener. If you've heard me speak before, you know this is one I talk about all the time. So what you're going to do is you're going to put your arms straight out. Now, if you have any shoulder arm issues, you can actually do this just with your hands at your hips. But if you are able to do this, please do it. I want you to squeeze your shoulder blades together. And think about what we're doing. So normally, like we're slouching a lot, right? So this is the complete opposite of that. So you're opening up your chest. And now relax. Make sure your neck is nice and relaxed. If you want, again, close your eyes, you can, but let's take a deep breath in. And blow it out. And just relax those shoulders back. Try and think of pinching your shoulder blades together, okay? You're squeezing your shoulder blades. You should feel a stretch in your chest right now. And you should actually feel the muscles in your upper back getting a little bit warm because you're working them, okay? So let's just hold that for a few more seconds. Awesome. And then shake it out. Now we're going to do the muscles on the side of the spine, so kind of your obliques and just these kind of areas. So we're just going to be doing, it's called lateral flexion. So stand nice and neutral. You're leaning to one side. So you should feel this almost even to your hip and into your low back. So you're going to stretch one way. So deep breath in and out. And just get a little deeper. Every time you exhale, you can get a little bit deeper into the stretch, and that's really good. So we'll hold this for, a few more seconds. And now we are slowly going to move to the other side. So same thing, you're actually running your hand down your leg, okay? So reaching down as far as you can. So now you should feel this on the opposite side, okay? So deep breath in and exhale. Now with these, I just want to mention, pay attention to your body from side to side. When you do these, you might notice that you're tighter on one side versus the other. If that's the case, try doing it twice on the side that's tighter, okay? And it could just be because of posture, the way you sit, the way you sleep, just patterns you've developed in your body, but start to pay attention to that and start to address them. And that's something you could talk to your chiropractor about as well to figure out why that's happening, because you should feel equal on both sides, really, okay? So there's something going on if you feel one side more than the other. All right, so the next one, I don't know if you'll be able to fully see me do this, but it's called a forward fold. You could do this from sitting as well. But you're going to stand neutral and you're going to reach your hands towards the ground. So you're going to feel this stretch in the back of your legs and in your back. Now, if you want to take it to another level, I love to do a chest opener with this and then come forward. Again, I know you're not going to be able to see me go all the way down, but you can do that. Imagine my head is towards my toes, okay? And my legs are straight. Now, you don't have to do the arms. You can lean forward like this, but I'm going to get you all to do that for me. So again, you're reaching as far as you can for the ground. Your legs are nice and straight. Everything is neutral, and either your hands are linked behind you or you're reaching for your toes. Now, hold that position and give me a deep breath in and exhale, and then sink a little bit lower into the stretch as you go. So let's hold that for a few more seconds. Okay, awesome. Now slowly come out of it. We have two more stretches that we're going to talk about. Now, these are ones that I would actually recommend you lie on the ground to do them. For the purpose of this video, I can demo it standing and you can see it, but all of you, I want to go down to the ground right now. The first one is lying on your back. What you're going to do is you're going to have your legs nice and straight, and you're going to take one knee and you're going to pull it towards your chest. So you're trying to bring this knee as close to your chest as possible, and the other leg is staying flat on the ground. You should feel this into your glutes, into your lower back. So let's hold it, and this is going to be a test of my balance. So deep breath in and blow it out. So again, I'm standing, but I want you lying on your back doing this right now, okay? So let's hold it for a couple more seconds. All right, let's slowly get out of it, and now we're going to switch, okay? So now that leg you just pulled towards your chest, that one's going to be straight, and let's grab the other leg. You're holding on basically on the other side of your knee. If you have any knee pain, you also actually could hold under your hamstring, okay, if that is bothering you, but let's pull it up. So deep breath in and out. Make sure the leg that's straight, you're really keeping it really straight and conscious of pressing the back of the knee into the floor or bed or whatever you're on right now, okay? So let's just hold it for a couple more seconds. Feel that stretch in the glutes and lower back. Awesome. And then we're going to finish with something called spinal twist. We kind of did a spinal twist when we did the spinal rotation, but again, I'm going to stand, but you should be lying on your back. So what you're going to do is you're going to put your arms out straight. So again, imagine I'm lying on my back. You're going to bring one knee to your chest, just like you just did, okay? But instead of bringing it towards the chest, you're going to rotate it. So you are going to rotate that knee towards one side, and then your upper body is all going to twist the other way. Your hand is going to be on that knee, pulling it down, but your arm and upper body and your head are looking the other way. So we're twisting. Okay, so take a deep breath in and blow it out. You should really feel this in your low back. Of course, if anything's uncomfortable, remember you always stop, but really try and maximize that twist and that stretch. Okay, so hold that for a couple more seconds. And then slowly come out of it. Now we're going to do the other side. So the opposite knee you're going to bring to your chest, holding here under your knee. You're going to twist. You're going to twist this way. Using your hand, you're going to pull that knee down. Your arm is out, and you're turning towards the other arm. So your upper body's going one way, and your lower body's going the other way. So we're twisting here, okay? So take a deep breath in and blow it out. And just relax. Every time you exhale, I know I've said this already, but every time you exhale, just loosen your body, get a little looser, get a little deeper into that stretch. We're going to hold it for a few more seconds. And slowly come out of it. So that's it, guys. That is my favorite spinal hygiene program. Thank you for participating with me. You probably brushed your teeth this morning, so you did dental hygiene this morning, and now you've just done some spinal hygiene. So congratulations to you. As always, if you have any questions, please feel free to message me, and I will do my best to answer them for you. Whether you are a patient of the clinic or not, I am here to help you, especially during this time. If I can help you feel better in any way, please just reach out. And secondly, please like, love, share this. If there's someone that you know is complaining about feeling stiff or tight or complaining about their posture, please share this with them. It is something simple that everyone can do. It takes a few minutes, but if you put some love and attention into this on a consistent basis, you're going to be in such a better position down the road. So I hope you found value in this. Like, love, and share it. Ask me questions if you need to, and just have the best day. You are so welcome, Lorna. Thank you for the comment. Thanks for watching. And thanks everyone that's participated. Have a good one. Bye.